Important Zepbound healthcare coverage update you need to know about. Hi, friends. I'm Elizabeth, Countess of Shopping. I have been on GLP-1 medication for the last 17 full months, having lost a whopping 90 pounds, changing my life from taking Mounjaro because of the Mounjaro shortage, switched over to Zepbound. Because of the Zepbound shortage, I'm now on a GLP-1 compound known as tirzepatide with a reputable compound pharmacy. We're going to talk in today's episode of why Zepbound healthcare coverage for you, having this conversation you need to think about, know about, and proactively plan for. All of my links, I will link down in the description link below. Just make sure to click that ... more button. Today's article is going to be from bridgemi.com. And of course, I will cite my source because I do require it to be factually accurate here at Countess of Shopping. As we go through talking about this new article about Blue Cross Blue Shield of Michigan won't cover popular weight loss drugs like WEGOVY, Zepbound, and what that means for you. And I want to break down this article. You may have already heard this news, or you may have been affected if you live in Michigan. You may have been affected. I'm not here in Michigan on my vacation edition of GLP-1 videos, but I wanted to talk today about weight loss drugs like WEGOVY, Zepbound, and Saxenda, which have recently gained popularity, will no longer be covered by Blue Cross Blue Shield of Michigan. It's interesting to me that Saxenda was also X'd off of this list as well. Starting August 1st, the state's largest health insurer will begin phasing out coverage for large group commercial insurance plans and eliminate coverage on January 1st, according to Dr. James Grant, the chief medical officer of the insurance company. Boo hiss, Blue Cross Blue Shield of Michigan. So going through and talking about these GLP-1 medications, for me, have been absolutely life-changing. For somebody who was on every single diet known to man, was morbidly obese, and now on my 100-pound weight loss journey. This was from before my vacation, right before my vacation. I look a little bit different on vacation time, but Blue Cross Blue Shield, this I think is important. Will continue covering GLP-1 medications prescribed to treat type 2 diabetes, including Ozempic, Victoza, Mounjaro, and the Rybelsus. I'm mispronouncing that. Forgive me, please. The costs are a huge implication. And so they're going through, and there's a major pullout. You absolutely need to know about this. So they go through and say the costs are a huge implication. Obviously, we have to look at drugs that we pay for, but we have to look at effectiveness. We have to look how our members are using these resources. When we've got somebody on a GLP-1 medication, more than 30% of the time, they actually stopped using GLP-1 medications in the first month. That blows my mind. Okay, that was end quote, by the way. That was quoted in the article. From Blue Cross Blue Shield, Michigan. And so resuming the quote. So what they're doing is they're actually not waiting long enough to see the positive effects of this drug. This is where I go back to, and it blows my mind, is that I don't think that people are necessarily getting proper education when starting a GLP-1 medication. If they're stopping within the first month, my guess is probably they're having these gnarly side effects, such as gastrointestinal diarrhea, constipation, nausea, or having fatigue, or having like leg cramps, which I have done 300 plus videos. Feel free to go binge watch all of my content. I'm not a healthcare provider, always talk to your own, but simply my experience, strength, and hope. But I predict the reason why Blue Cross Blue Shield is because they're not educating patients before prescribing them to them. And that's why people are stopping. If people were well equipped, well educated, in my humble opinion, and I know that there's obviously, this is my gut instinct on that. I don't have, of course, the data to back this up, but having now been in this space for the last 17 months in my own journey, knowledge is power with this. And they're saying that the reason why they're stopping the insurance coverage, well, then I go back to at the genesis before any prescriptions are written, are patients knowledgeable of what they can expect with these medications? You're probably going to feel tired. Are there some severe, horrible side effects like pancreatitis and appendicitis? Of course. Less than 1% though. Less than 1%. Now, those beautiful, precious 1% of people, of course, that affects them severely. But for other people, it's an inconvenience of diarrhea. It is an inconvenience of constipation. It does not feel great to be fatigued and tired. And if you want all those solutions, again, go look through. You can go binge watch all of my videos on those. But going back over to this article, that is the reason why it says it's just unaffordable, and we have to make difficult decisions. Grant said. This is from Blue Cross Blue Shield Michigan. We didn't make this decision lightly. Of course, there was a lot of analysis with this. So January 1st. They're going to eliminate the coverage, said Dr. James Gray, the chief medical officer for the insurance company. WEGOVY, Zepbound, and Saxenda are FDA approved to help with chronic obesity management, and they're part of the family of GLP1 agonists. So they are keeping again for type 2 diabetes. So that's good news for our type 2 diabetic friends. But going back over to the annual claims for weight loss drugs skyrocketed from $8 million in 2021. Which, by the way, why did I not know about these in 2021? I feel like people now talk about how GLP-1s have been around for forever. How did I not know this? How did I not know this? This skyrocketed cost from $8 million in 2021 to $100 million so far this year, and that's in 2024, about halfway through the year. The company is on track to spend nearly $200 million by 2025. The average monthly price listed for a semaglutide, which is Wegovy, is over $1,000, according to a brief of the Blue Health Intelligence commissioned by Blue Cross Blue Shield Association. Similar weight loss drugs cost between $900 to $1,000. So the company is in line. Blue Cross Blue Shield of Michigan's decision to eliminate coverage for weight loss drugs put the company in line with other insurers in the state that don't cover those drugs. A survey conducted, this was the important part. If you've made it this far, first give yourself a pat on the back because this is important. A survey conducted last October by the International Foundation of Employee Benefits Plans found that 76% of employers said that they would cover GLP-1 drugs for diabetes, type 2 diabetes, while 27% said they would cover them for weight loss. 27%. It can be incredibly frustrating for families when insurance coverage is switching, the medical director of pediatric health optimization services at Helen DeVos Children's Hospital said. And they go on and talking about this, about how people are just not wanting to cover. So I think that that's really important, and that was the important piece of this part, is that 76% of employers will cover that for type 2 diabetes. But for chronic obesity management, and we know the plethora of comorbidities that come with that, high blood pressure, sleep apnea, you can go through and see the other areas, heart disease, that are now in clinical trials to get FDA approval for GLP-1 medications, or have been FDA approved. That this is a punch to the gut, so to speak, but I do believe as we have more data, we'll be moving past, but it's going to take some time. You guys know I'm solution oriented. I'm not going to be henny penny. The sky is falling. I'm going to be solution oriented and give some solutions here. So yes, that is a blow, particularly for people who their insurance company is. My question to you is, can you switch with open enrollment coming up? Can you switch to another insurance company that does? That would be number one. Number two, for me, that's why I moved over to Compound. My insurance company would not cover for me. I started off on Mounjaro and then moved to Zepbound because of the shortage. My insurance company refuses to cover Zepbound. They keep saying, oh, maybe we'll add it, but they're not. And so I moved to a Compound because of the shortages, but that Compound, could you potentially do that? I don't know. And again, always finding a reputable Compound pharmacy. I work with, my telehealth company is Join Fridays. I work with, you can use the discount code QUEEN. I picked them and bought my subscription when I first started because I love them. And because I think that they are the experts in chronic obesity management treatment. You can get that down below, as is their compounds. I literally took my compound before I left here for vacation, brought it down here on vacation with us. It's in the refrigerator, and I have a special spot. I've done other videos on this too, if you're traveling with compounds, particularly with children in the house, because they are needles in there. And I'm going to be taking my compound right after this video. Actually, I was like, I'm going to do it right after I do my last video for today for filming. So is a compound an option for you? I like Join Fridays because I know they're working with reputable compound pharmacies. Do your due diligence, of course. But I like Join Fridays because I can swing easily from Mounjaro, or it would be Zepbound and Wegovy for chronic obesity management treatments, and then over to compounds easily. So you can do brand names or you can do compounds. So I know this is a blow, with the insurance companies, but one, can you look for a different insurance company? Now, give yourself time to do research. You put yourself in the driver's seat, things you can control and things you cannot, and the wisdom to know the difference. This is the time you should have wisdom to start doing your due diligence and start researching other resources. That's one. Two, like having a backup plan for insurance. Two, is compound an option for you? Paying out of pocket for me with compounds substantially less than paying for brand names. I feel basically the same, slight difference, but I don't know, by the way, if that slight difference is because I'm on the highest possible dose. I'm on Zepbound 15 milligrams. Oh, we got a windstorm. Hopefully that's not affecting the mic. Is compound an option for you? Is that an option to switch over to that? Maybe that's an option for you. And three, knowing that it's going to continue to get better because I think, this is where I put my opinion in, I think the reason why people are stopping, that astronomical number of people are stopping 30% in the first month, is a lack of education and a lack of knowledge. And people need to be more knowledgeable before they get a prescription for what to expect. If they knew what to expect, then they would stay on it longer. And therefore, if they're staying on it longer, they're going to get these benefits, these health benefits that we've been talking about that are with comorbidities. With the recent study showing that there was 20% reduction in stroke events and cardiovascular events and heart-related disease. Facts, proven facts. Sleep apnea. I mean, there's all these other things that are happening as a beautiful result of tirzepatide and semaglutide. So, sweet friends, I know it can seem daunting, but please continue to fight the fight. Don't give up. That solutions are coming. And you may need to go, for me, I was like, I'm going to go on a compound for a little bit. I'm praying that my health insurance will cover it, but if they don't, we will switch. Like, I'm so annoyed and tired. But it's interesting that the big domino fell of this affects a lot of people in Michigan, from Blue Cross Blue Shield. And I do want to say they're on the wrong side of history. The right side of I know they had to make a financial decision. And as a businesswoman who's owned multiple multi-million-dollar businesses, I get it. It's costing them a ton of money and they're not seeing the payback because people are dropping off these medications way too early. Then work on the problem of getting people not to drop off these medications way too early, as opposed to, if that's the root of this, and I'd love to know your thoughts in the comments below. Would love to know your thoughts in the comments below. If that is the real root of this, then let's get at addressing and doing proper education for people. Blows my mind. By the way, as I came out here, my treat was my LMNT electrolytes. You guys know I'm obsessed with LMNT electrolytes. They've been very gracious with the Countess of Shopping community to give us 8 free sticks with any drink mix purchase, I should say, drink mix purchase. But I was having my amazing, it's sparkling electrolytes. I had these because today's shot day, and whenever I do shot day, I always take my electrolytes the day of, the day after, and then day 2, essentially, because it helps with my side effects substantially. I've tested with electrolytes and without electrolytes, and it's made a big difference for me. So highly recommend, highly recommend LMNT electrolytes. And then also, of course, my magnesium. I take that separately. I take that at nighttime, and I use the type that has 7 types of magnesium. I'll link that down in the description link below for you too. Now, I was talking earlier in another video, I got so many questions on my Oura Ring. I will link it down below of what a big difference it's made for my sleep. How I knew that was because I was testing for the magnesium, because the magnesium was why my sleep changed. But the Oura Ring, I strongly encourage, if you're on a GLP-1 medication, the data is fascinating for sleep and stress response. It tells you in there like, hey, it's a recovery day, or maybe you should be more gentle with yourself, or today you can push yourself. It's really helpful to give factual data for my specific body. So I will link that down below. I have loved it so much. The sleep stuff alone, let alone all the other information. And they recently came out with a caffeine study. I'm like so stoked to try. And a new study of like, what is your actual cardiovascular age? I'm going to be doing both of those. So stay tuned. More information's coming on that. I love the Oura though. Like, I highly recommend. I'll link that. That's on my Zepbound Amazon shopping list if you're just starting GLP-1 medications, or you want to try some new things to help. You don't need to buy anything, but I always love to have things that kind of push me ahead of where I would be otherwise. And so it's been helpful to have those. So sweet friends, I will link down below in the description link below the article that I was referencing today. If you've made it this far in the video, your accountability question is, what are you doing today to move you closer to your goals? And number 2, our emoji for today is going to be a pen. a pen or a pencil. That is like our bat signal. It signals to me that you've made it this far in the video, and I want to get to know you better if that's so. I will pray over you. If you don't believe in prayer, I'll uplift you in a positive thought. So put the emoji, a pen or a pencil. And if you're working out, know that I'm giving you a big high five. I love when people are dual tasking or multitasking while they're listening to my videos too. Be kind to yourself, be kind to others. I'm Countess of Shopping. Count my blessings because life is delicious. I look forward to seeing you guys again next time. Bye, guys. Have a great day.